Okay, parents, you know there is a lot about the actual process of having a baby that you don't realize or no one ever tells you until you actually experience it for yourself. And even if you have a specific birth plan in mind, that doesn't mean that's how it's going to happen in reality. So what are the options you have when it comes to pain management during delivery and what you can expect when it comes to changes? Bridget is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, like anything else, when it comes to children, things don't always go exactly to plan, but the right OB-GYN, a medical professional, will be able to guide you to the best possible experience. And that's why we have Dr. Cynthia Bernal here today. Thanks for coming in. She is an OB-GYN with Orlando Health Physicians Associates. Good morning.
Good morning. Thank you for the invite.
When it comes to the birth plan and pain management, what do you like to tell first-time moms?
I think it's especially when it's a first-time mom or even somebody that probably already had a baby before is to approach the whole idea with an open mind. I think right now there's a harsh market out there for the actual birth plan, quote unquote, and there's nothing wrong with feeling like you have somewhat of an anticipation of what you think you might want there to be available for you, whatnot. But I always tell my patients, be open-minded. Let's get you all the information available so that you know what you have that you might want to count on. But at the end of the day, I always feel like I tell them, let the pain guide you so that you don't feel like even before you start to experience labor, you have to put yourself in a category where I have to follow the rules of my birth plan, because that can be very difficult for some patients. It sets the bar high sometimes where they feel that if things don't go according to this plan, they might feel a little bit disappointed and start feeling like things are getting out of control. When the reality is just to enjoy the process as much as possible, knowing that the outcome is just to have a healthy baby and making the best experience for every mom.
Right, and trusting the professionals is so important, and having that good relationship. Talk to us about, say, hypothetically, you want to go natural. You know, you do want to have the baby at the hospital, but you want to, you know, try to be as natural as possible. What are the stair steps of, okay, maybe I do want a little something because this is more than I thought it was going to be?
I think it's that's a great question. It's usually what we tell patients is you don't have to feel that you have to sign yourself up or plan ahead if you're going to. When you're planning for something natural, one, having a great relationship with your doctor to be able to express to them what your plans are, what your concerns are. When you literally enter into the hospital, you don't have to sign up for anything. You can just start seeing how you experience labor. There's plenty of options initially when you feel like you might not want something or you're not ready for something like IV pain medication. There's birthing exercising, our birthing balls. We have a great team at Winnie Palmer Women and Babies with our labor and delivery staff that help guide patients and give them those options. And as labor progresses, if you feel that that pain kind of starts settling in, you have different steps where usually
you'll give them the option though before it's too late.
Patients are always given options at all times, and what we always usually tell patients is everybody questions when is it too late for an epidural. And we normally say it's not that it's late. We don't really use if you're 9 centimeters or 8 centimeters, that's it, you can't have it. No, it's usually a combination of things. Sometimes, most of the time, it's just because baby wants to come right now, and to have an epidural you need to sit up, and if at that time baby's already on the way, it's just not possible, and the patient herself, she won't be able to tolerate sitting up at that point. It's just let's have a baby kind of situation. But if at any point during a woman's labor she feels that she is ready or she wants to consider an epidural, that is always an option available for her.
What are the levels to that?
So the levels of epidural, if you mean different kinds, we have a walking epidural and a quote-unquote full. Walking epidural, like the name implies, gives the patient that good relief, not eliminating her ability to still be able to walk around, be mobile if she wants to still use her birthing ball, getting up to the restroom, so it doesn't leave her kind of stranded on her bed. Some women do very well with that, and that's all that they might need. But if, as again, the labor progresses, women feel like they need a little bit more help, they might choose to convert it to a full epidural, which just means our anesthesiology team adds more medication to the point that hopefully the relief is greater, and that tends to cause what we talk about, like the droopy, sleepy legs. A patient is now bound to her bed because she wouldn't be able to be as mobile.
Now, I do want to talk about this because it happens often where, you know, a mom has an idea of what she wants it to be, but the outcome is totally different. And sometimes, you know, it's emotional, it's disappointing because they, you know, it didn't turn out the way they had fantasized or imagined. Talk to us about that emergency C-section and just what comes into play when that does happen.
I think in order to make that situation as best as possible, first, at least with my patients, is even earlier in the game to let them know that we're going to plan for the best experience possible. But even before it happens, I like to tell them that when that moment comes, even though in our mind we're thinking this is going to be a vaginal delivery, I like to warn them that there are rare but possible scenarios where if something happens, an entire team might come in. In that moment, we might just have to go for an emergency C-section, so that hopefully, if it does occur, in that moment, they will still probably be a little bit very stressed, but they'll remember that, okay, this is necessary. If it occurs that a patient perhaps hasn't been giving that warning, when you come in, you try your best, depending on the emergency of the situation, to give the patient immediate information as to why that needs to happen and how urgently it needs to happen. Building that trust in the moment of labor is, I think, a key figure where a patient needs and should feel comfortable with the provider that they're working with, so that they know that any decision that is being made, even if it's last minute, it's always with the good intention of knowing that all we care about is a healthy baby and a healthy mom.
Yeah, great information. Well, thank you, doctor, for coming in today to talk to us about that pain management and all the excitement that goes with that birth process. All right, back to you, Julie.